Hi, everyone. Good evening. And thank you for joining us for this fireside chat on COVID-19 and young adults. We're going to discuss the rise in new cases, the Delta variant that you might have heard of, and lots of things that you need to know to get protected from COVID-19, and obviously lots about the COVID-19 vaccine. So I want to introduce myself. I'm Dr. Mandy Cohen. I'm the secretary of the North Carolina Department of Health and Human Services, and I'm so grateful for you joining this really important conversation. I am here tonight with TikTok stars Josh Curitan, also known as Just. Hi, everyone. Can you hear me? I'm Dr. Mandy Cohen. I'm the Secretary of North Carolina Department of Health and Human Services. Sorry we started late, and I hope some of you heard some of what I said before, but if not, I will start again. We've been working really hard in North Carolina to protect everyone for over a year. And I'm excited to be here tonight with TikTok stars Josh Curitan, also known as Just Josh, and Harley Powell. And we have the amazing Ivy Jones to serve as our moderator tonight. Ivy's been an amazing community advocate for COVID-19 vaccines here in North Carolina. So thanks, Ivy, for being here. Josh and Harley, I'm excited to get into the conversation. Before we do, just a little bit of background. We've made a lot of progress vaccinating people in North Carolina. More than 60% of adults have gotten at least one dose. However, a third of our youth between 12 and 17 have only gotten a dose. So we have a lot more work to do. We're going to talk about why, even if you are younger, why getting a vaccine is so important. And one of those reasons is the fact that this virus has changed. The Delta variant is real. It is new. It has changed, and it is stronger. We are seeing a rapid rise in cases, and hospitalizations means young people are getting sick from this. And unfortunately, it is the people who are unvaccinated that are getting really sick. So we're going to talk more about that tonight and ask each other questions. So we know what we need to do, and that's get more people vaccinated, because vaccines work, they are safe and effective. But unfortunately, fewer people here in North Carolina are vaccinated, which is exactly why we're having this conversation. You may know that we've been giving away $1 million in a cash drawing, as well as college scholarships. So if you're under 18, you can still get vaccinated right now and be entered in a college scholarship contest. If you're over 18, you could win $1 million. We've given away $2 million already. We're about to announce our third $1 million winner. So very exciting. So, the vaccines, great in and of itself. These are a little more incentives so that you can also maybe win $1 million or get a college scholarship in addition to that vaccine. So we know you want more information about vaccines, and that's why tonight we're joined by our guests, as I mentioned, TikTok stars Josh Curitan, also known as Just Josh, and Harley Powell, and tonight's moderator, Ivy Jones. So as we dive in, I think I'm going to turn it over to Josh to kick us off to share some of his own remarks.
Hey, what's up, everybody? Thank you, Secretary Cohen. So I'm a 19-year-old political science major, sophomore at the University of Miami in the honors program. I'm on a pre-law track. I haven't fully decided if I want to do law yet or be a politician, but I started social media about 2 years ago. It's been going great. It's allowed me to pursue careers as a comedian, actor, activist, and influencer, and I'm really lucky to be here. I'll turn it over to Harley.
Thanks, Josh. Hi, I'm Harley. I just graduated from ECU about 2-3 months ago in May. I'm 22, and I majored in public health while at ECU. I was also part of their honors college, and I am on a pre-PA track. So right now I'm also getting to actually I'll be starting to work right in the health field as an EMT in the next upcoming months, which I've already gotten to experience some of that. And just hearing from a lot of the EMTs who were kind of there in the height of COVID has been really interesting to hear their perspective, as well as the paramedics. And so, a big part, the idea of majoring in public health was just perfect for me, because I felt I got to do all my sciences that I needed for the PA route, but also learning more about epidemiology, which ended up coming up really in hand with COVID going on now this year, and seeing how we track the spread of things, and just also teaching the public about things like tonight, vaccines and other health issues.
Thank you so much, Harley and Josh, and I've really enjoyed hearing a little bit more about you all. And thank you so much, Secretary Cohen, for having us together today. Like Secretary Cohen said earlier, my name is Ivy Jones, and I'm going to be moderating today's discussion as we answer any of your questions or concerns as it pertains to the COVID-19 vaccine. If you have any additional questions for either Josh, Harley, or Secretary Cohen, feel free to leave them in the comment section, and we will be able to read those and answer those if we have time. But thank you so much anyways for tuning into this discussion. Secretary Cohen, I'd like to start with you. In your intro, you talked a little bit about vaccine rates in North Carolina. And overall, we're seeing a rise in new COVID-19 cases. In your words, what do you attribute to the rise of COVID-19?
Yeah, it's unfortunate. I know we've all been through a lot in the last 18 months, and we're seeing some of our lowest rates earlier in the summer, and that was great. We could take off our masks. We were hugging folks. We were traveling. We were going to parties. It was awesome. But in just the last few weeks, we've seen a rapid rise in cases. Today alone, in the last 24 hours in North Carolina, we saw more than 2,300 cases. And we already know for tomorrow, my team was telling me we're going to be over 3,000 cases in just 24 hours. So we have, a lot of virus spreading here, and it's because this virus has gotten stronger since last year, and it has changed, and it is called the Delta variant now, and it is what is spreading across North Carolina and frankly the whole country. It is stronger. It's really, really contagious, much more contagious even than last year's version of the virus. So that is really what's causing it. And unfortunately, it is really attacking people who are unvaccinated, IV. So the vast, vast majority of people who are getting sick right now are not vaccinated. And that's what we're seeing. Almost more than 90% of the cases are all in people who are not vaccinated. So that's really a problem. So that's what's causing the rise. The virus has changed, and there are still a lot of people who are unvaccinated, and folks are getting sick, unfortunately, and getting into the hospital.
Yeah, absolutely. So the low vaccination rates are definitely impacting COVID-19 a lot, as we're seeing towards the end of our summer. Case spike is happening in North Carolina, and there are a lot of unvaccinated people. Josh, have you gotten the chance to get your COVID-19 vaccine? And if so, why did you get vaccinated?
So I actually recently got vaccinated. I honestly hadn't planned to, or at least not for a while, but I just got tired of how different my lifestyle was now than from what it used to be. I'm a sophomore in college. I started during the rise of COVID, so you can imagine how different my freshman year had to be from everyone else's. And these are supposed to be, the years of my life that are the best and I have the most fun. So I just wanted to return to normal, and I wanted to enjoy my life without keeping 6 masks in my pocket or sit 3 desks away from my best friend in class when I got to go to class. And it was also annoying seeing, every business shut down after 10. So this is what helps us return to normalcy. I'll take the first step.
Absolutely. And Harley, what about you? Have you been vaccinated yet? And if so, what was your reasoning?
Yes, so I got vaccinated. I got my first shot back in March, and then my second one in the beginning of April. And for me, a lot of it was actually on my dad's side. We had a family member who passed away early on from COVID, right at the height, or right at the beginning when everything was so unknown. And then just having high risk family members and, wanting to be protected and also protect others from this, virus. And kind of like Josh said, just hoping to get back towards normal life. I mean, for me, this started middle of my junior year. So my last year and a half of college was spent online when, senior year of college, you're looking forward to those last final things with your friends and doing all these fun kind of senior moments for college, which didn't really get to happen for me. But hopefully by getting vaccinated, people below me get that kind of opportunity to get that normalcy in college and get those, couple of years to enjoy.
Yeah, absolutely. And I love both of your answers because they're honest, and everybody has their own personal reason for getting the vaccine. But taking that first step, like you said, Josh, is the most important step in creating a healthy community. Secretary Cohen, is it true that people ages 18 to 24 have the lowest rates of getting vaccinated when compared to older age groups? And they also have the highest risk or the highest rates of COVID-19 cases?
Well, so unfortunately, yes, and it goes hand in hand. The less you get vaccinated, the more likely you are going to be to get COVID. And I will just tell you, this Delta variant is very contagious. It's going to find you. And so I want to make sure that everyone goes out and gets vaccinated. So yes, our unvaccinated adults are significantly younger compared to older ones. But just know that no one is invisible to this virus, even when you're young. And I know we're going to get into that.
So, Josh, what do you think is keeping young people from getting vaccinated then if they have the highest rates of COVID-19?
I mean, well, specifically to our state, I feel like it's because North Carolina is a conservative state by majority, and a lot of major political figures on the right have downplayed the severity of COVID and the effectiveness of the vaccine. And as young adults and teens, we're highly impressionable, even though we like to think we're not. So it's hard to mobilize people to get the vaccine when you have the most influential person in America opposing it and not taking COVID seriously. And then we have our parents pushing their beliefs on us, whether we wholeheartedly agree or not. And it just becomes our beliefs. And another big thing is that rumors spread a lot faster than the truth. So you have these speculations that if you get COVID, you can't get it again, or that the vaccine is a way of controlling people, or that it's going to make you sick, all these opinions. And people just go with it instead of researching and learning for themselves. But it's just easier to not get the vaccine and not get involved.
Yeah, absolutely. And Harley, same question. What do you think has kept young people around you from getting vaccinated?
So, kind of to Josh's point as well, this idea, of rumors are spreading faster than the truth. I definitely agree with that. But also, at least from the perspective of the college town I was in, I think a lot of people were, before we kind of had the vaccine rolling out, a lot of people were like, well, I want to go live my life. I mean, I could look on my Snapchat on a Saturday and it looked like COVID didn't really exist. Just from people, not necessarily like close friends, but just people I knew. And, you could see everybody going out. Greenville had opened up the clubs and the bars. And so I think a lot of people saw it as, well, I went and I didn't get COVID. And now there's a vaccine, but I've been going out for months and I never got it. So I guess I'm fine and I don't really need to get the vaccine. And then I also have friends who, they've kind of come to me because they are not in the health field and they've asked the questions about, like, or they've said to me, this just seems like such a new vaccine. And then just from my knowledge from classes and stuff, I'm able to kind of explain to them that it's not necessarily as new as you think, because of the idea of there being multiple SARS viruses. And, this has actually been studied for 20 years. So I think there's some hesitation in that idea that it's new, even though it's not necessarily super new. And then also just that idea of kind of invincibility. Well, I didn't get COVID, so I don't really need the vaccine.
And hey, guys, can I ask you a question? Because, I hear you all saying that rumors, spread really quickly. And so better than maybe some of the true scientific information. So who do you think, your friends are listening to when they're like, hey, I actually want to learn about some of this stuff? Like, or who do they listen to? Where do they get their information?
Honestly, I think what I've seen just in general with not even just COVID, but a lot of, human rights things and COVID and other things, a lot of people seem to get their information from Instagram posts where it's like the small infographics. But I think the most helpful thing is the people who make those infographics and provide links at the end of them, because you can only give so much information in these tiny posts, but then to provide access to where you can get more of that information. I think a lot of people find it really easy to just kind of click on the post on someone's story and go flip through it really fast and learn a little bit, and then go learn more if they decide they want to do more research. That's at least what I've seen among my friends.
And Josh, what about you?
I feel like the best way would be like primary healthcare physicians, like the same doctor you've seen since you were 1 year old, sitting down and telling you like, hey, this is the best thing for you. Like, I want to see what's best for you. So I feel like you should make this decision.
I definitely agree with Josh that that's also a great source that people are likely to listen to, especially if you've got that relationship with them where you've seen them since you were a little kid, or however long. it's somebody that hasn't led you astray yet. So you're more likely to listen to someone who, has led you the right way for all these years.
And what about you, Ivy? I know you're the moderator here, but what about you and your friends? Who do they trust? Where are they going for information?
Absolutely. I think surprisingly, I think a lot of my peers have sourced their information from family members or family friends that work in healthcare as well. I think while we might not all have people in our family that are physicians, a lot of people do have family members that are nurses or other healthcare workers, technicians of some kind, EMTs, people who are connected to healthcare besides being physicians. And I think a lot of information around the vaccine and a lot of information around COVID safety comes from is funneled through those individuals onto their greater communities, and people will trust them because they do work in healthcare. So I think that's a source that I've noticed a lot of my peers would reference. Oh, my friend is a nurse, or so and so in my family is a technician and has seen this in their hospital. So I think that is a really widely trusted source is other healthcare workers. But
Great.
I think
Thanks.
Oh, sorry.
No, I was just saying thanks. And we're gonna take that back. I heard Insta. All right, we got to be more on Insta and get the links at the end.
Yeah.
And we got to get our making sure our doctor. Right, it's about relationships with a doctor or other trusted person, and making sure you have that to connect to in your life. So got it. Thank you.
Yeah, absolutely. And Josh and Harley, a lot of people look up to you for information. Sorry, I don't know if you can hear me, but Josh and Harley, a lot of people look up to you for information, which is why we're glad we're having you today. You're trusted influencers. You're on TikTok. You're all over social media, and people will see you for information or just for anything. And you're a trusted source by a lot of young people. And like we've discussed previously, a big barrier for young people not getting vaccinated is because they feel the sense of invisibility and that they've been engaging in normal activity and haven't gotten COVID-19 or haven't gotten very sick. What would you say to your peers or the people who shared what you shared with us about feeling invincible, and how would you kind of encourage them to look at this from a different perspective and encourage them to get vaccinated? And we'll start with Josh.
I mean, I'd say a lot of times when we hear these things that COVID really doesn't affect people our age, we don't think about the bigger picture. We don't contextualize it. We just hear it doesn't affect you. And we don't think about the people we may come into contact with. We're healthy, but what about that old lady you just hugged, or the kid you just high-fived? If you don't get the vaccine because you're healthy, you can still get it for your baby brother who was just born, baby sister who's in elementary school, your grandparents you go visit all the time. I live with my grandmother now, and I just had a niece, so I know I'm keeping them safe. We're in the best condition of our lives right now as young adults and teenagers. We feel like we're Superman. Superman was invincible, but Lois Lane wasn't invincible. So we just have to keep an eye out for those people around us. It's so important.
And I think to Josh's point, kind of similar to that is that I feel like what I've seen among a lot of people, or articles that you're seeing now, where it's like this person who was so opposed to getting the vaccine got it, and it was because somebody close to them died of COVID. And I think it's this idea of don't let somebody who's close to you having to die or suffer greatly from COVID be the reason. Get the vaccine before that happens, because it could be, because there are stories where it was like a teenager passed it to their parents or something. It's that idea of go ahead and protect them now so that you don't have to be that story of, well, somebody close to me died, so I didn't believe in it first, but now I'm going to do it, because it's like you don't want that to be the case. That's what pushed you towards it. And I just find that a lot of people, it really has to kind of hit close to home for them. So sometimes it's even, like Josh said, relating it. Think about those family members of yours that either can't get it or are at higher risk, even if they have gotten vaccinated. Which I know with the vaccine, you are a lot less likely to, have a really bad reaction. But, also people who have certain health issues where obviously there aren't many, luckily, with this vaccine, but there are some where people can't get that vaccine. So you want to protect those people around you. And if you have the ability to do that, then why not, get a jab in your arm and maybe not feel good for 24 hours, and then you're protecting everyone around you as well as yourself.
Absolutely. And so following into that, and I think this relates a little bit back to what Josh said, Secretary Cohen, what is your reaction to young adults who might say, I'm young, I can fight COVID-19 if I do happen to get it?
Yeah, I get it. But what I would say is, in addition to protecting others, there are real consequences if you get COVID yourself. And I'm not that worried about you getting into the hospital. I think you can fight this off, but I've seen a ton of young people in particular lose their sense of smell, and it doesn't come back, right, for months and months and months. And people will having no sense of smell sucks, like, right, feeling. And then you get COVID, and but people can get long-term symptoms. You get a cough, you get sick, you can get over it, but then we're hearing about people who are about a third of people long-term feeling really tired, feeling foggy, again, can't smell, having trouble breathing. Like, you don't want any of that stuff. I know, that's, you want to be living your best life right now, right? And so why wouldn't you go get a vaccine? It can protect you, protect others, but not have any of these important, impacts of COVID. So while I'm not worried, are you going to be able to, most people fight this off? Of course. But there could be real impacts to you personally long-term for your health. I find the most inconvenient one is that whole not smelling thing. I like to smell.
Not tasting. I like to eat, so.
Right? You like to eat.
Yeah.
I want to smell my pizza, right? But all joking aside, like, there are real health consequences to you too. You don't want any part of that. Get the vaccine.
Yeah, absolutely. And, for me, besides all the other great reasons to get vaccinated, like you said, Secretary Cohen, post-viral illnesses are a real thing, and post-viral symptoms are a real thing. And while you may fight off COVID-19 just fine, you could have some other consequences that can be minorly annoying at best and seriously challenging for the rest of your life at worst. So getting the vaccine is one way to really minimize, almost to elimination, the risk of having some of those serious post-viral illnesses. So it's really important to get the vaccine, reduce the possibility of getting post-viral illnesses, because you don't want those. You don't want to lose your sense of taste or your sense of smell. Definitely don't want that. So we know that people have concerns, and that's why we're here tonight, to address those concerns and make sure that everybody is able to get vaccinated, knowing that they made an informed choice to do so. And we also want people to understand that there's no reason to wait. It's really important to protect yourself and your loved ones by getting the vaccine as soon as you possibly can. So again, Secretary Cohen, a lot of people have this wait and see or wait it out attitude. And what do you say to that?
Yeah, well, I definitely think that there is no time to waste here to get vaccinated. And it's because we see our cases going way up. And again, it's because this virus is getting stronger. So the sooner you get vaccinated, the better. And so we really, really, cannot wait for folks to get vaccinated here. I think we need to do this right now. Frankly, I wish you would have done it already, but that's okay. Let's do it now. Want to get you in under the wire to win $1 million or a college scholarship. But look, cases are here. This virus is here. It's all over the place, and it's going to find you if you are unvaccinated. So it's time to take the step right now.
Absolutely. And so, besides having a wait and see attitude, and for a lot of young people thinking they're immune from the virus, what fears do you think people have specifically about the COVID-19 vaccine, whether that be misinformation or just, not knowing about certain things about the vaccine? What fears do you think people have?
You want me to start, Ivy?
Yes.
Well, look, I've heard, I've done a lot of these talks all over the state and been talking to folks. First, I get it. No one's a fan of shots, right? I get it. I'm not a fan. But let's talk about that. So, there are options for a one and done shot. If you are over the age of 18, you can get a Johnson & Johnson shot. If you're under 18, there's only one option for you. It's the Pfizer. It does come in 2 shots. So, but also, some people are like, oh, I don't want to feel sick, but when I get it, what am I going to feel like? And I'd say people feel everything from nothing to, feeling a little crummy for 24 hours, but then you're done. Like it's over, and then you can feel good about being protected going forward. So what I would say is, like, commonly we hear that people have a little bit of arm soreness. Maybe they feel a little achy. They take a little Tylenol or some Advil, and they're sort of on their way and good. And I think we've heard, I don't know if Harley, you mentioned talking about, was this vaccine too new? Do we need to learn more about this? And I'm
Right.
also looking at data and learning new things, but 200 million people in just the United States have gotten this vaccine. I think you've given it some time. We've seen how it's working, right? And so we know that this is safe and effective. And so, I would say go make sure you're getting good information about this vaccine, because it is safe and effective.
Absolutely. And so, Josh, how do you feel, after you've received your first shot, how do you feel knowing that you're one step closer to being protected from COVID-19?
I feel good. I was unsure about it for a long time, iffy if I was going to get it. But I feel like being secure is a lot better feeling than being uncertain if you're going to get COVID. And it's kind of a flex. Your friends ask you, like, oh, I don't want to go here. I don't want to get COVID. You're like, oh, I got the vaccine. So, it's not the same for me. But, and just even feeling excited, to go back to college and do all the things I wasn't able to do, or have a little more leeway, come back to my life a little bit. So it's a really good feeling.
Harley, what about you? How do you feel knowing that you're protected?
It honestly, it feels great. I mean, I remember the day that I was able to book my appointment. It was actually a friend and I went together. She was able to get hers because she was student teaching, and I was able to get mine because I was working in a research study that was a clinical trial where we were working with people. So we were able to go sign up, and I remember she had been a little hesitant about getting it. One, because she doesn't like needles. And in the end, we went together. I held her hand, and if she's watching this, she knows, and she tells everyone that I held her hand. But we both felt just like this kind of like relief kind of wash over us. Even after that first one, even though knowing like it was going to take some time to kick in, it just like knowing. And when I told my parents I was scheduling, I mean, and then just soon after they were able to do theirs. And then luckily my brother, his college campus offered a few, and it was just this big relief for our family, where especially we have people who are high risk in our family, like in our immediate family. So just knowing that we were able to get one step closer to being protected, and my brother and I not having to come home from school and quarantine fully. And so it was just very exciting.
Yeah. So just to clear it up, Secretary Cohen, can people who are vaccinated still get the vaccine? Can people who are vaccinated still get COVID? I'm sorry.
Oh, can they still get COVID?
Yeah.
So look, we all know in the world, there's nothing that is perfect out there that is 100%, but these vaccines are as close as we can get to perfection here. So we know that the vaccines are about 90% effective, which means not perfect. So it is possible to still get COVID after you get the vaccine. So I don't want to have misinformation about that, but it's incredibly rare. When we look at all of the cases that are happening now, more than 90% of them, nearly all of them, are in people who are unvaccinated. So it's always possible. And even just yesterday, the CDC did say if there's a lot of virus around where you are, it puts you, even if you're vaccinated, at a little more risk. Now, the risk is smaller, so it's good. Like I said, nothing in this world is ever perfect, but it's pretty rare. And so what worries me more are the folks who are completely unvaccinated. That is certainly, what keeps me up at night is folks who are unvaccinated, because this virus has gotten pretty strong and very contagious.
And then Secretary Cohen, you were just talking about, how it's become rare that someone who's vaccinated could get COVID. But on that topic of rarity, should people be worried about developing blood clots? I remember when the whole scare happened with Johnson & Johnson, people got really nervous about the idea that they could develop a blood clot from this vaccine.
Yeah, I want to say, when I said the breakthrough cases are rare, wow, clots are super, super, super rare, super rare. Like I said, possible. And what I would say is that is our safety system working. We were able to detect 10, 15, 20 cases out of millions and millions and millions and millions of cases. I mean, it is so infinitesimally rare, but possible. Again, it was just in women. It was particular ages, and what I would say is that it's incredibly, incredibly rare. And what is less rare is getting COVID, right? Is getting COVID, particularly now that it's more contagious. And so, the FDA, the CDC, all the national organization continue to recommend all of the vaccines. I'll say I got the Johnson & Johnson vaccine, and I'm a woman that falls in that, I'm not telling you my age, category. But right, so I got the Johnson & Johnson, no impacts from the vaccine at all. Again, these are really rare things.
And then what about fertility issues? I know that was another concern in both men and women.
Yeah. So again, we've been looking at a lot of data, but as of right now, there is absolutely no evidence that any of the vaccines have any effect on fertility in women or men, I should say. So no impact on being able to get pregnant, no impact while you are pregnant, and no impact while you are breastfeeding. In fact, what we see is women who are pregnant, if they get COVID when they are pregnant, particularly later in their pregnancy, can get really, really sick. And we obviously don't want that to happen. So we are recommending everyone get a vaccine. No concerns about fertility.
I actually I just glanced over at, I have my TikTok live up, and somebody did ask, what can people who are unable to get vaccinated for any health reason, what can they do to, help stop the spread and help protect others and keep themselves safe as well?
Sure. Well, first, I would say have a conversation with your doctor. There are very few circumstances in which someone couldn't get this vaccine. It's essentially only if you are allergic to the ingredients in the materials of the vaccine. You can read the labels, and if you had a really bad reaction to something like that before. So there's very few reasons why someone couldn't get the vaccine. So I would encourage you to have a conversation with your doctor. But if after that conversation you have made the determination, hey, I can't get the vaccine for a medical reason, masks are the thing that really show that they work to protect you and to protect others. But you need to use them consistently. It has to be well-fitting. And so that's really, really the tool. We did a lot of things over the last 18 months to try to slow the spread. But what it comes really down to at the end is masks and, frankly, washing your hands all the time.
Thank you so much.
Thank you so much, Harley and Secretary Cohen. Actually, following up with another viewer question, which actually relates a bit to a question that I had. There are a lot of people who are concerned about potential long-term side effects of the vaccine, and their concern is they don't know that they don't know, is the vaccine safe since it's developed and approved so quickly. But how can you address some of the emergency FDA release and how that process works, and how can we know that the vaccine is safe even though it's been developed over the span of a little bit under 2 years?
Sure. So first, a couple of things. Let's talk about how the vaccine itself works. So one, I think, Ivy, you even mentioned it. This vaccine and the way it was developed has been studied for decades. And we are very lucky that all those decades of work was done so that when we hit COVID, they were able to do their work really quick. And I would say no corners were cut. But when we had this major thing happen in the world, you had all the smartest people and, frankly, money and attention going to this. So we were able to streamline processes and make sure that money was no object, right? So companies invested and put all their efforts towards it. And so it wasn't that there were corners cut, but it was really just a matter of a real efficiency to be like, how do we get this done without any delays? that we may have seen in the past. So I want folks to know that clinical trials, all the data, and again, now more than 200 million people in the United States alone with vaccines, and that's great. And the vaccine works by teaching your body to recognize COVID. And so and then it disappears, right? So it teaches your body, hey, this is what COVID looks like. If you see it, jump on it, get it out of your body. That's what it's teaching it to do. And then those instructions that teach your body, they disintegrate, they go away. So yes, has this vaccine only been around since last year? Yes. Well, COVID's only been around since last year, but we know how vaccines work from decades of research, other kinds of vaccines. And so we have decades of research on other vaccines to know about any concern around long-term impacts. Any impacts from a vaccine are usually seen within those first 2 weeks or so. And that's what we have seen when we were talking about very rare clot or even just, feeling icky for 24 hours. It's usually very close to when you get the vaccine because it teaches your body and then it disappears. And so I am not concerned about the long-term impacts of it. But what I do know is there are long-term impacts of getting COVID. Right. So you have to weigh all of these things, right? You can't just say, oh, in isolation, I'm worried about this thing in 10 years. What about the thing right now that we know could impact you right now? So we have to put all those pieces together.
Yes, absolutely. And thank you so much for explaining a little bit more about how we can know that the vaccine is safe for people to use and how we know we have decades of knowledge behind the vaccine. And it's not just, we're putting our all into really creating a safe and effective vaccine. And we're also using previous knowledge that we've developed over the years. So thank you so much for explaining that a little bit. I also just wanted to ask, how can we know, or how do you know that the virus is getting stronger? And how does that work? How does that process with the Delta variant and other forms of the virus? How do we know that they're getting stronger, and what exactly does that mean?
Yeah. So, well, unfortunately, we just have to look at our numbers. So we have scientists that are looking at the virus all the time. And what I should say about viruses is we know that that's their job, is to get stronger. That's what they want to do because they want to keep spreading, right? They want to spread and live their best life, which means that if they see a vaccine or the body is attacking it, it wants to change so that it can keep spreading. And so this is somewhat expected. We see this happen with the flu virus each year. It changes, and that's why we have to get a new flu shot every year because the virus is a little bit different. And so that's what's happening here is the virus is changing. And unfortunately, our scientists have been studying it. And what we see is it's super contagious now. It was contagious before, which is what's scary about it. But now it is really, really, really contagious. And we can see it in our numbers. They're just really going up really quickly. This happened in India, then it happened in the UK. It's now happening here in the United States. And so that's why I'm saying, and this is all unvaccinated, this virus is going to find you because it's really contagious.
I had a couple questions from the viewers. One of them wanted to know about, you said the Johnson & Johnson vaccine is one shot. I think Moderna and Pfizer are both 2 shots. What's the difference? And are they both equally safe? Are there any health implications from one of the vaccines?
Yeah, great question, Josh. So, yep. So 3 different vaccines. One's the one and done shot, which is the Johnson & Johnson. The other 2 are 2 shots, and they're the mRNA. They all basically work the same way, meaning that they are giving instructions to your body to be able to identify COVID. They were just tested in slightly different ways. They were using slightly different technologies. But I would say, again, we continue to see they are all effective. The 2-shot regimen is only available for those who are under 18. So if you're under 18, Pfizer's your option. And it's a great option. It's showed to have probably the highest effectiveness of all of the vaccines, though Pfizer and Moderna act very similarly. Like I said, I got the Johnson & Johnson. I was kind of interested in the one and done. So, it's really a matter of what works, for you. If you're not interested in needles, I get it. Do the Johnson & Johnson one and done. I would say the Pfizer and the Moderna that give you the 2 shots, you do get a little more boost of your immune system, But like I said, I'd take any of them. I did take the Johnson & Johnson. So you really can't go wrong. The only wrong choice here is staying unvaccinated.
So I'll let you go, Josh.
if the Johnson & Johnson is one shot, why isn't everyone able to just get that shot?
Why isn't it 2, you mean?
Yeah, I guess.
Yeah, it was just the way they studied it. So like it was everyone knows, right, in human nature, right? I'd rather have 1 shot than 2. Like if I can get the same result. So I think when they went into the clinical trials, they said, let's see if we can get this down to 1 shot. But the Pfizer and Moderna, they just didn't test it that way. So they tested it with 2. So they got approved for 2. Johnson & Johnson tested for 1. They got approved for 1. I think it was just a choice they made early on to say, hey, we think folks will love the 1 and done. Let's do that. I don't think it was anything more than that's what they made a choice and how they tested it. I think they're testing other ways. So going forward in the future, we may see Johnson & Johnson have 2 doses to go forward, and we may see different dosing regimens for different people as we study this a little bit more. But this is the protocol that was studied to be safe and effective, so that's what we're using.
So, oh, sorry.
I was just going to add really quickly, I think for a lot of the young people, you could relate to kind of the process of getting vaccinated for school and a lot of the different required vaccines that you have. Some of them are 1 shot, some of them are a series or the multiple doses of the same vaccine, but they're all equally effective in protecting you against certain illnesses that you don't want to get in school. So that's just some of the logic behind why we have 2-shot versus 1-shot vaccine. And the timeline behind it is all based on the effective science that we've already been able to discover in the past, and we're applying it now. But I think Harley had another question from a viewer.
Yes. So this is actually from a viewer. I was just checking through to see if there were any other questions. But this is something I've seen other people questioning, and especially family members of mine. Half of my family's from Canada, and they've had their own issues with vaccine rollout. And one of the things they started suggesting, because they had AstraZeneca up there, and then there were some issues with AstraZeneca. Some people were getting recommended to do kind of mixing and matching almost. It was kind of like get the vaccine you can. And I just wanted to know, Secretary Cohen, what's your opinion on that? I know they haven't done a ton of studies, but that there has been some evidence that it could possibly give you even more immunity or that stronger immunity to COVID.
Yeah, I think scientists are looking at that to look at. Right now, we have them, if you get Pfizer, you get Pfizer. You get Johnson & Johnson, you get, right, no mixing and matching. Just because that's just not the way they were tested. And again, it's why we can feel good that these are safe and effective. We tested them and we want to use them the way they were tested. However, they're in these new trials trying to say, okay, well, if you got Johnson & Johnson and then got a Pfizer, what would that look? They're doing those studies right now. In addition, they're thinking, oh, we've heard this talk about, are we going to need a booster, right? Because the vaccines teach your body how to recognize COVID, but there's 2 problems. I just told you COVID's changing, right? It's changing. And so we may need a booster to either teach our body to recognize the slightly new version of COVID, but it's also sometimes our body just forgets. Right. It's been a long time, and what's called waning immunity, it forgets how to recognize COVID, and it needs a boost. And so we might need it for either. Our immune system starts to forget or the virus changes. So we may need to come back and do this to make sure we're protected. But what I would say right now, that's not what we're recommending. We just want you to get your first dose the way they've studied it already, and the scientists are doing their work right now.
Absolutely. We're going to take 2 more viewer questions, but I actually have one viewer question, and that is, Secretary Cohen, can you explain a little bit about what herd immunity looks like or what that means and why it's important to get a lot of our population vaccinated so that the spread of COVID-19 can slow down?
Okay. Herd immunity, complicated term, but let me ask you this. Have you or any of your friends ever had measles? No, that's right. It's because everyone gets the measles vaccine. I am old enough to have gotten chicken pox without getting the vaccine, right? But no one really gets chicken pox anymore because everyone gets the vaccine. That's herd immunity. When you have enough people who have gotten the vaccine of something, that this virus basically isn't spreading. Now, sometimes we have pockets here and there where we start to see less people get the vaccine, and all of a sudden Disneyland had an outbreak of measles, or this school or that. But it's very, very rare to even ever see that anymore because of vaccine, and we've reached some sort of threshold for that, that enough people got vaccinated. Clearly, we're not there for COVID, right? Our cases are surging. We have about 40% of adults that are not vaccinated. So we're not there. Not enough people are vaccinated to make this go away. And I'm not sure that we will ever get there, but I'm hopeful, and we got to start somewhere. So each vaccine that happens not only protects the person, but it starts to protect us all, right? Because if you're all protected, it also means that this virus can't get to you and then change, right? That's what we also want to prevent too, is this virus changing. If it spreads to you, that means it has another chance to change and get stronger, and we don't want that to happen either.
Yes, absolutely. Thank you so much for explaining that a little bit more, because I feel like that is also a term that young people have seen, whether it be on Instagram or other social media, but may not be fully aware of what that means or what that looks like. So thank you so much again for.
I was going to say, I would say most people, including some scientists, sometimes we misuse the term herd immunity. So, understood.
Yes. Thank you so much. Josh, Harley, do either of you have one last viewer question?
I have one. One of my viewers wanted to know if eventually, was there any chance that the vaccine would be a requirement?
So, I mean, it's a good question. And I would say, I think there are going to be circumstances where that vaccine is going to be required, particularly if you are working a job where you're working closely with very vulnerable people. I think you're going to see healthcare settings, and I will say we're already starting to do this here in North Carolina. So if you work closely with very medically frail people every day, you can bring them a virus and make them very sick. And so I think you will see places will require vaccines, particularly if you work with vulnerable populations. And then others may say, look, we don't want to see outbreaks here. We don't want to have to cancel class. We don't want to. So we are also seeing some of our universities say, you got to be vaccinated to come back. And that's not a new thing. We've had to be vaccinated for other things to go to school our whole lives, right? And to be in the public schools. So that's not a new thing. I don't anticipate seeing that for public schools right away, particularly because a lot of kids under 12 can't get vaccinated yet. But I think some of our private colleges are already doing it, and some others, and some I don't know if your colleges are mandating. I'll just say Duke University here in North Carolina is one of a number of universities that's going to require it. But don't wait for that, right? It's coming. So get it now, be protected, and, check that box.
Yeah, absolutely. And I think Harley has a viewer question, but just really quick, I'd say that from my university, we've strongly encouraged our students, staff, and faculty to get vaccinated as soon as they possibly could. And I know that the effect of that was that we were able to have a really strong virus management throughout the semester that I spent on campus this past spring, where we didn't have any major outbreaks of COVID-19, which was really wonderful and really rare for college campuses to accomplish this past school year, especially with a lot of the lack of social distancing and the congregation that we saw across college campuses in the country. So
do college kids like to congregate?
Apparently they do.
It's been so long. Parties. Yes, I've heard of them. Yes.
Yes. Okay. And so we were thankfully able to manage really well. And I think now moving into the fall semester, my university has been able to effectively kind of predict hopefully what we might be able to expect in terms of what an on-campus semester can look like and how we can best keep each other safe. And that includes strongly recommending all students, faculty, and staff to get vaccinated. And so we have like an anonymous vaccine tracker that actually is able to display what percentage of our campus community is vaccinated. And thankfully, across student, staff, and faculty, over 80% of our campus community is vaccinated. And so, I think looking at college campuses and their vaccination rates, that can also be a model for how other communities might fare in terms of getting the majority of their populations vaccinated. So, Harley, what was your question?
Also, just because we had also discussed college campuses, another thing I had seen, just because this real quick, but just I have already graduated, but just talking to my friends, I know ECU, what they're doing is if you're not vaccinated, you have to sign a waiver that you're willing to be called at any point to take a COVID test. And they're going to be doing cheek swabs or mouth swabs instead of the nasal, but that's their way of kind of keeping it. Well, if you're not going to get vaccinated, then you're going to get tested whenever we call you into. But this last question that I had is about how to travel the rest of the summer and still take precaution, because I know a lot of people prior to the numbers kind of spiking again book trips, want to go see people because they're vaccinated. So what's the best way to stay safe and take precautions even if you are vaccinated already?
Yeah. Well, yeah, I think you hit it on the nail. The first thing is like be vaccinated and make sure that the folks who you are going to hang out with and travel with are vaccinated. Assuming that is the case, I do think that it's still good to take some additional precautions. And so you may want to get a test as you lead up to that vacation. So maybe like 3 days before, get a test, day of, get a test. And so it's just like an extra layer of protection. And then it depends what your vacation is. If you're going to hang out on a beach, then, you're outside, you're not hanging out with a lot of people. But if you're going, into something where you're going to be indoors more and others, if you're going to be indoors particularly in areas of the country that have higher viral spread, and that frankly, that's North Carolina, it's a lot of the South. I would definitely wear a mask indoors. That's what the CDC is now recommending. It's just an extra layer of protection. Again, I think the vaccines work. But hey, it doesn't hurt to have an extra layer of protection, and that's what the CDC recommends. So that's what I would do. But I would think about tests as you lead into your vacation.
Absolutely. And thank you so much, Josh, Harley, for your audience's wonderful viewer questions. I think those have also been really insightful. And thank you so much, Secretary Cohen, for being able to give responses for each of those and really give insight and kind of quell any concerns that the audience might have about getting vaccinated. So at this time, we're going to move into our kind of closing remarks. We only have a few minutes left in our discussion, but it's been really wonderful hearing from everybody. Josh, Harley, for your insights and also for your questions, and y'all's respective audiences. Thank you so much for asking any and all questions that you might have. And we are hopeful that we were able to answer some of them today. So I just wanted to hear before we wrap up, starting with Josh first and then Harley, do you all have any closing remarks or any final thoughts you'd want to leave us with?
Well, I feel like it's definitely important to keep getting the word out there, keep spreading it. I know usually like we get the word out through TV, advertising, radios, but this generation, the young adults, teenagers, I don't even watch TV anymore. So it isn't as effective to advertise to us, but social media is something we use a lot: Instagram, Snapchat, TikTok. So continuing to use these outlets to advertise is going to be a big part of it. And I think you guys right track and start to make those necessary steps, especially like using influencers like us who have those connections with the people on close to a personal level. And I think that's what's going to be very impactful moving forward, especially using politicians on both sides of the spectrum to emphasize how important this is. Clearly communicating that what the truths are, myth busting, catching out the rumors, and just incentivizing people to get this vaccine more. I think that's going to be a big part. And thank you guys for having me. The NCD, HHS is doing a great job. Looking forward to see how things progress moving forward. Make sure y'all follow me at Just Josh. And thank you guys.
So just to wrap up, I really liked what Josh said about the idea of, keeping this push on social media of talking about COVID vaccines and COVID, because a lot of younger people are all on streaming services. So they're not really getting those commercials in between their shows and stuff. But also just that idea again, as we talked about earlier, of getting the vaccine before it's a situation where something happens that hits close to home, like a family member getting sick with COVID or something like that. It's important that even though you feel healthy now, why not get this extra thing to keep you and others healthy? As well as if you're a college student, getting this vaccine gets you one step closer to being able to go out and do all those fun things again in a way that you really know the chances of you getting COVID are so low, rather than going out, taking the risk and hoping you don't get it.
Absolutely.
Sorry. I just want to say thank you for having me on tonight.
Yes, and thank you so much, Harley. Y'all make sure you follow Harley and Josh. Harley is on social media at Harley with 2 Y's, HARLEYY, Powell with 2 L's at the end. And Josh said his Instagram or social media earlier, but it's also just JUZT Josh. I believe that's correct. And y'all make sure you follow up with them as well. Secretary Cohen, what would you like to say to close out tonight?
Well, first, Ivy, great job moderating. Josh, Harley, awesome to be on with you. Really, really good questions. And I know that there were more out there from your followers. So we'll make sure that we grab those and answer those for everyone. We want to make sure we answered questions here, but it was a great discussion. I hope the takeaway was get your vaccine if you haven't already. And if you have, get on Insta and make sure you're posting something about why you got vaccinated and why your friends should get vaccinated too, right? Because if you're all vaccinated, you can go to that thing. What did Ivy say? Oh, party. Yeah, do that. And enjoy your summer and go back to school and college for those of you at school, or enjoy living your best life. So get vaccinated. Make sure you're getting good information. Great discussion tonight. Thanks for doing it, Josh, Ivy, and Harley. Thanks.
Yes, thank you so much, y'all. And make sure you go to myspot.nc.gov for vaccine information. If you haven't gotten vaccinated yet, encourage all your family and friends to do so. Thank you so much, y'all. Have a great night.